Hi, everyone. I'm Camellia. I am a practicing psychiatric mental health nurse practitioner, also known as a PMHNP. I'm also a nursing and mental health enthusiast. And today, what I wanted to do is continue the series of obtaining or performing a psychiatric interview. I have done a couple of videos thus far, and the first video I sort of talked about an introduction with some ins and outs of what I found helpful and some particular considerations for working with patients and with starting a psychiatric interview. My last video, second video for this series, talked about how I introduced myself to the patient, also talked about the chief complaint and how I prompt the patient to tell me more specific information about what brought them to the office. And then thirdly, I talked about the patient's own psychiatric history and how to obtain that. So just as a natural progression to the psychiatric interview, I typically go in this order, as I've mentioned in previous videos. And so the next thing that I want to talk about today, and this is our chunk of the interview that we'll focus on, is obtaining or performing a psychiatric interview and getting information about the patient's family history. Okay. So usually, as I said in the last video, I would talk to the patient about their own psychiatric history. And I usually sort of lead into a question with the patient by asking them, so tell me what you know about your family's history as it pertains to mental health. Another way you may be able to term that is, has anyone that you're aware of been diagnosed or treated for any mental health condition? And so many times what you're going to find, you may get various responses, but many times patients, one, don't know the information because it hasn't been something that's been normalized to talk about family-wise. Other times they may just not be aware because they don't have that information about their family. And sometimes that's also based in stigma. It's based in particular beliefs around mental health. So you may not get any information with this, but when you ask particular questions about family history, just as you would for knowing if there's a family history of hypertension or diabetes, you would be basically possibly getting some clearer idea about what may have led to the patient's condition and or how other factors may be a part of that. So many times we think about family history, particularly with disease and some of the things as far as diagnosis. There are some mental health disorders that are very particular with genetic predisposition. And examples of that would be things like bipolar disorder, sometimes ADHD. And so much of psychiatry is also not just the environmental factors, but we also have to play into the biological makeup of every patient. And so there is a correlation with particular mental health disorders. So that's important from the diagnosis perspective. But secondly, one other piece of information that's helpful would be if someone has been diagnosed, what they've been treated with. So why is that important? Because what we find is that many times there can be a correlation between either side effects to any medications, or sometimes that can also mean that there can be efficacy. We're looking at, how effective a medication has been for a family member, and sometimes that does point us toward what may be more effective for the patient. Again, this is only if you're prescribing medications. And I mentioned before that medications don't always have to be a part of a treatment plan. You also want to know if there's been anyone with substance abuse challenges. You want to know if family-wise, if anyone has attempted or the patient is aware that anyone's died by suicide. And you also just want to get a general gist of those things because it can play into possibly either stressors, or it can also play into, again, genetic predisposition for the patient. It doesn't mean that the patient is going to definitely have anything that a family member, particularly a first-line family member, was diagnosed with. Sometimes that's rooted in a misdiagnosis. Other times it just isn't true. But that information can give you sometimes a clearer idea of what you're looking at, the propensity for a patient to develop a condition, and or their response to treatment. So that's why those things are important. If you can't find any information, patients don't know, then of course you can move on to the next section of the psychiatric interview. So this video is pretty short today, and I just wanted to sort of give you a snapshot of what's important for family history, why it's important. And again, if you can't get any information, then you can move on. But I'm hopeful that this video was some helpful to someone if you've been following the series, and I'll continue to talk about more specific chunks of the psychiatric interview as the weeks go on. So do look out for the next video. If you guys have found, again, other ways that you've found things helpful when you are working with patients, or if you have any questions, comments, or anything else that you'd like to add to this, please let me know, message me, or send comment below. I look forward to seeing you guys in the next video.